Hi there, everybody. I'm Robert. Hope you can hear me okay, coming from the woods up here in New York. So first, I just want to say I'm honored to have the privilege of kind of closing out the conversation in this community over the last couple of days. And want to thank Bruno for giving me this opportunity to leave you with some closing thoughts. It's weird not to be able to see you all. I was in Milan for the Interaction Conference in early February. So hoping I might have bumped into a few of you at some of the sessions or social events around that event, as I assume there's a fair amount of overlap between those two groups. So for this talk, I kind of want to bring us back to the moment in time that we're in. And I'd like to frame it around the concept of a macroscope. I don't know how many of you are familiar with the writing of John Thackeray, but I believe he coined the term macroscope as kind of a corollary to a microscope. A microscope allows us to see very small details and structures in the world and understand the world better by seeing those invisible structures. And a macroscope does the opposite from a big perspective. How do we see the big patterns around us? How does that reveal the structures and the way the world works from a macro perspective? So I know we've been spending a lot of time talking about craft and tools and very specific mindsets. And I'm hoping I can connect that as we transition from this event back out into the world, connect that to the moment that we're in. So this is an incredible map. We're in the midst of a universal experience around the world. So this is a map showing all the countries that have now been exposed to COVID. And with a few small exceptions where cases are not reported, we're in the midst of a universal experience. One that's going to change the trajectory of our lifetimes and of what we do as designers. So how do we make sense of it? And how do we understand it? Just want to ask everybody to take a moment to reflect on the experiences you've had over the last 6-8 weeks or more. Your family and friends, how this has changed their perception of the world and the way we're all connected. As well as think a bit about people and communities for whom, even as this experience may be easing up in parts of Europe and Asia, there are places in the world where this is just beginning to hit and have a massive effect on people's lives. So my team has spent the last 2 months talking to people from all over as part of kind of the way we stay connected to the communities that we do user research with. And that's everything from small business owners in places like New York, who are just trying to tap into a little bit of money to keep their businesses going for an extra month, to a young woman in Lagos, Nigeria, who has spent all her money on food and can't go out to find more work, to a daily wage earner in New Delhi, who is counting on the government and the way that they distribute rations to support his family, but he's afraid of visiting a school, afraid of being exposed, both him and his children, to disease. Or this laborer from Bihar, from northern India, who's trying to pull together enough money to pay for the daily charge on his phone so that his child can stay connected to education and school in the small way that's possible at a moment like this, as they still see education as much of a necessity as food. So these experiences are remarkably similar from all over the world. As I mentioned, I lead the design team at Dahlberg, and our work is really about tapping into the needs and challenges that vulnerable communities face. And we do that out of a footprint in Nairobi, Mumbai, New York, and London. And today that footprint of our work is growing massively to include people in so many parts of the world, both here at home in the US, in Europe, and abroad. And we recently got together on a call, pulling together our design team of about 30 people from around the world and sharing the stories we were hearing. We, as I said, work often in vulnerable communities. And so it's not unusual if we are doing user research and designing products and services for rural farmers in Ethiopia that we'll hear a number of stories of distress. If we talk to 10 people, 2 to 3 will really get to the heart of kind of the challenge and create a very emotional kind of intensity for our team. And today, that's true in every conversation we have. So this is a time of terrific heartbreak, but it's also a time of terrific beauty. Scenes like this from Prague, or the blue skies that have opened up in New Delhi, where I was this past November. It's also a time of hope. This comes from Edelman, that does an international survey every year on trust. And 64% of the people they reached out to across dozens of countries believe that the pandemic will lead to a fundamental shift to a more equitable society for us. Finally, it's a time of belief. And a lot of what I want to communicate today is about believing in the power of design, believing in the special role that this community can play at a moment like this, and the special value that design can bring to helping the world through this incredible crisis and transition. So why should we believe in the role of design? So these are my parents, the Fabricants. They're in their 80s, and they look at me and think I play a special role in their life, not just as their son, but as a bit of an oracle. My mom writes for the New York Times, and she had to get on her first Zoom call last week. So she asked me remotely to help her out with it, help her get set up. I'm sure you guys play this special role for many people you love in your lives. Unfortunately, she was faced with terrible experiences like this, launch tabs taking over her browser as she tried to figure it out. Similarly, on her phone or on her iPad, Zoom taking over and launching multiple windows to try and do a very simple thing. So she looks at me as an oracle to try to explain to her, why do things work this way? Why were they designed this way? And when I look at something like Zoom, this is what I see. I don't see Zoom. I see something called ICQ. It's the first time in the mid-90s that I looked across the room at someone's computer and saw a grid of 8 small, low-resolution video streams as they were involved in a chat messaging app. At the time, ICQ came out of Israel, was bought by AOL. But for me, the first time I started to see what was possible when your computer turned into this communication and social hub. When I look at the apps that are popping up on everyone's phones as they try and navigate through this world, I don't see material and the commonalities that are built into the Android operating system. I see HyperCard and the whole concept of cards and buttons, of stacks, as a very simple, fundamental, practical interaction model that sits underneath so much of what we use today. And when I check my news apps and news feeds for the 1,000th time a day, I don't see the New York Times app. What I see is this demo that I was privileged to see in the early 90s at the MIT Media Lab from David Small. And it was the first time I'd seen a tablet, and in particular, demonstrating the idea of tilt and scroll as the most simple and natural way to interact with text. I'm sure you all have different examples, but the reason I bring this up is that to the people around us, this change over the last few years, and particularly during the pandemic, makes it feel like new ways of engaging are coming at us all at hyperspeed. It feels like warp speed. It feels like Star Trek to my parents. And yet to us, we've had the privilege of seeing these concepts build up like layers of sediment over time. They're not perfect, but I understand why there's a handoff between clicking on a hypertext link to a Zoom app and all the tabs and other things that happen before you get into that video experience. So we're in a privileged position because of that history and because of the way we've seen it build up over time. My personal history really starts in 1984. I'm dating myself when I went to college and brought with me the original Apple Macintosh computer. And that's really the beginning of my journey. And that journey has taken me forward as I've seen the layers and concepts around the way we interact with digital information grow and build during that 35-year period. But I'm also seeing how broadly that influence of these concepts and the reach of them have grown during that time. And it led me to reach out to Cliff Kwang, who is an amazing designer and journalist, to figure out how we would tell that story. And not just the story from my perspective moving forward, but the story that leads all the way back. And so we created this book called User Friendly to try and frame that in the broadest possible terms for a broad possible audience, and to show at least a 150-year span of how these ideas have shaped our culture and society today, and in particular, how they connect us back to this very moment in time. So coming back to the idea of belief, why should we believe in the relevance of design when people's lives, their education, their hunger, their very survival is at stake? In many ways, Cliff likes to say that at the heart of this book is a Copernican shift. And it certainly, we wouldn't be here without that shift from thinking about the experiences and the products and all the things around us that we engage with as us as a small cog within those, to one in which we place the user at the center. And that shift has touched off changes in so many fields, and so critical, for example, in the field of health. So if we take a little bit of a journey down that road, this is from the 19th century, Florence Nightingale, who used data and information and design to transform the public health system. At this time showing, I don't know how many have seen this before, but showing the fact that most soldiers were dying of infection in army hospitals and off the battlefield rather than during, as casualties directly during battle. Or this universal system of communicating health during the TB pandemic that was developed by the Isotope team to try and create a language that could work across cultures in a different pandemic, so that people could understand a bit more about how the disease was spread and a bit more how to adapt their behavior more effectively to manage that spread. Most recently, my team had the privilege of working with a series of different partners, including the US government, USAID, during the Ebola crisis, and looking at how to bring the principles of user-friendly and user experience design into things as basic as personal protective equipment. And in this case, participated in working sessions that brought a range of designers, including fashion designers, to look at how to make the doffing and donning both simpler and easier, but also more sanitary for health workers during Ebola. Design has also played an amazing role in a number of crises. Going back to World War II, many of you may be familiar with this, but at the end of World War II, looking back again at casualties, it became clear that many, many pilots were not dying due to enemy fire, but due to what was classified as pilot error, basically crashing their planes in the water or onto aircraft carriers. And it took a few behavioral psychologists, Paul Fitz and Alphonse Chapanis, to go back and look at this pattern and say, you know what, if this was error, it would be much more random. But they found quite predictable things that led them to believe it was a problem of design, and began a shift, that Copernican shift, towards a more fundamental user-centered way of thinking about technology, about devices, and about the gadgets and the equipment that we interact with every day. Or it could be more recently, during my lifetime, the 3 Mile Island nuclear disaster in the late 70s that brought the entire nuclear industry in the US and in much of the world to its heels. Pre-Chernobyl, this was in many ways the biggest nuclear event in the world. And again, on the heels of this, the government formed a commission to look at how did this happen and what caused it and what could be done to prevent it. And they brought in a whole set of technical experts, including Donald Norman, who you're all familiar with. And his conclusion was that it was a problem of design, and many of the concepts behind his famous work, The Design of Everyday Things, in terms of mental models, feedback, mappings, came out directly from looking at what happened and looking at the fundamental design mistakes that were made when these reactors, and particularly the control rooms, were laid out and built out. Again, more recently, during the refugee crisis in Europe, we had the chance to work with the UN system, particularly with UN-OCHA, when I was at Frog, and launched something called the Humanitarian Data Exchange. So this is a platform that allows a host of first responders across many different categories, from NGOs to government to multilaterals, to share data, very, very precious data, to best prioritize resource and respond. That data could be about the locations of airfields, the conditions of roads. It could be about population movements. It could be about the availability of health supplies. And this has grown to be a huge resource with more than 17,000 data sets, both active today on COVID, but continuing to support many crises, including the Syrian refugee crisis, by bringing together stakeholders to not just post data, but to create a language called Hexel that allows the exchange of data and the mapping of data across data sets. A final piece of history in terms of the relevance of design has to do with vulnerability and the idea that design doesn't just look at the world as it is, but looks at difference and the experience people have as they experience it in different ways, and tries to use that to better design the world both now for people, but also for the future. I hope some of you are familiar with the groundbreaking work of Patty Moore. That's the same person on the left and the right, one picture from the 70s and one picture from today when she was the recipient of a National Design Award last year from the Cooper Hewitt in the US. So she in the 70s was working with Raymond Loewy's office and noted that they were always designing for an average man. And she asked herself the very fundamental question, why should we be thinking first about that person when we think about products? And so she got some friends of hers in the theater industry to create an outfit for her so that she could experience the world as an aging woman. And it wasn't just a visual outfit in terms of how the world saw her, she actually had weights built into it. So she moved more slowly. So sitting and getting up and getting onto a bus, all these things were more tiring. And if you know that story, you know that it led, amongst other things, to the creation of the OXO product line. So her partner at the time was one of the founders of Smart Design. And a very simple, user-friendly idea of a handle, and not just a handle that's more comfortable, but one that looks obviously more comfortable through the visual signifier of these fins, that wouldn't just benefit the audience and the users that she'd been thinking about, but would be better for everyone. We can see other examples of this idea of where thinking about people with different needs has led to breakthroughs, whether it's a symbol of tech success like the Aeron chair, whose mesh came from research into materials to prevent bed sores in hospitals, or more recently, the groundbreaking work of this man, Augusto Los Rios, who was a creative director at Microsoft and had a crippling accident that paralyzed him from the waist down, and led him to be an evangelist in Microsoft for designing for disability. That's led to many innovations in both products and in process and how they work, including this version of the Xbox that allows people to adapt different peripherals depending on how they might want to engage with the game and what their capabilities are, really targeted at vets coming home from the Middle East in the US, and amputees finding different ways to get back to and have the same experience that the rest of us have. So if you believe that design is highly relevant in a time like this, what does the role of design look like? I'm going to tell you a few stories that come out of our work today. So these are things that my team is involved in that are happening right now that illustrate the span and the breadth of what UX thinking can bring to this very moment. So first is about awareness building. So we've been working with a number of governments, including the government of India, to look at how to put very simple information into people's hands through WhatsApp. And how do you make that information as useful and meaningful to people as possible? Through a series of partnerships, a program like that is scaling up to dozens of countries right now and giving people an opportunity to get very simple information from reliable sources the minute that the crisis is starting to affect their daily lives. So this is some of the work we're doing there to explore how to improve ways to make these interfaces more conversational, ways to push consistent information out to people. So building on some of the comments around content that we were just hearing. Then there's mobilization. So even though these guidelines are very simple and consistent across so many parts of the world, how they play out and how you adopt them can be brutally different. So in this case, we've been working with communities across Nairobi, dense, urban, poor communities, to figure out how to mobilize a massive pool of sanitary resources and behavior change into those communities, whether that's through a new service model and kiosks or other tools to try and make sanitation and healthier habits at a time like this even possible for communities that that live in very dense environments and are very restricted in their ability to access clean water and to find private space. There is testing. We're not doing anything COVID related, but I've been working for more than a decade on the concept of self-testing in HIV and other areas, and the ability to combine mobile services to guide people through that process, as well as rapid diagnostics, into a different kind of user experience, and something that's going to be more and more relevant as we look forward. There's looking at risk more broadly, coming back to that idea of designing for vulnerability. So our team is working with several governments to look at how we map data, whether that's cellular data, to look at the movement of people and figure out where people are gathering, or whether that's demographic data, looking at things like age and looking at mapping density of population, so that we can help governments and other first responders figure out how and where to channel and to target resources to be most effective. There's decision support. So my team, again, funded through USAID and other partners during Ebola, started working with a host of different regional and national governments to look at how, not just to capture information about disease and pandemics, but also to share it and create community around it so that people can learn from each other across borders, given that this disease does not sit easily within national boundaries. And together with many partners, including the Gates Foundation, looking at how do you build that capacity, the capacity to collaborate and the tools to share knowledge and information in a way that's easy to adopt and that maps very directly to the workflow and the tools that are in use in communities in West Africa and other parts of the world. So this is a place where our team is trying to look beyond just developing tools, but thinking about the broader question of how you build a capacity to respond and make decisions at times like these, to safeguard large groups of people and populations, and respond to the changing nature of a crisis like this and to the experience that's happening in other places. So these capacity building institutions aren't just about COVID, but are about long-term better coordination and better preparedness across not just the developing world, but the developed world. The reason I gave these examples is not just to take you through a tour of the work we're doing, but to reflect on how this is different from some of the historic examples that we talked about. That we're moving from tools and communications to fundamentally being on the front lines of behavior. So about a decade ago, I gave a talk around this idea that behavior really is our medium as interaction designers and UX designers. And this is the moment when that's coming to the forefront. So I wanted to share some reflections on how this is playing out. And these are emerging and will be changing over time, but bring us back to that idea that at the heart of what we can do and the heart of what we bring as a unique community to the partners and the organizations that are trying to get a handle on this incredible health challenge, that closeness to behavior and the ability to adapt and create experiences that shape and support behavior change is one of the most critical things that we offer as a community. So again, back to that map, this universal experience that's touching every part of the world simultaneously. Yet if we look at it, it's incredibly contextual. So you've probably seen these images of people using chalk or other markers to not enforce, but represent social distancing out to their community. And these are taking so many different forms in so many parts of the world. And I'm sure you're all seeing and engaging with it, whether it's in your local pharmacy or whether it's out on the street. It's a powerful reminder that communities are together figuring out a way to kind of represent and bring these principles around behavior change, around social distancing, right to the ground level in the world around them. There are also new behaviors emerging in different places, whether it's a behavior like this in India as well, where people are stamping themselves to show and signify that they are supporting the quarantine, or whether it's WhatsApp groups that form very rapidly in Wuhan for small neighborhoods to get together and share resources and communicate. There are lots of little emergent behaviors happening in different places and propagating around the world. Trust fundamentally is more and more local at a time like this. So part of the reason we're working with a lot of national governments is that people trust that the government of Ethiopia is giving them the information they need. And with so much noise and so many different rumors running around, it's more important than ever that the information we share and the way we engage them is grounded in a source they can trust and is coming from a source that they can trust. This one has been fascinating. You know, ever since this outbreak started, because it started in China, there's been a wave of data and infographics. I think we've all swum in that sea, trying to use them to make sense and understand, well, what should I take away from this information? What is this supposed to tell me, this map, this bar chart? And it comes back to that idea, I think, that Norman first started exploring at 3 Mile Island, that idea of mental models. And this mental model of flattening the curve is something that has taken hold in many parts of the world as a concept that I think people really use to help explain why they're staying home, why they're quarantined, and frankly, why they're willing to make sacrifices in terms of their ability to earn a basic living or to go get rations. It's not just about their own personal protection, but a concept and a story that comes out of data, but that's taken hold in a much bigger way. And we know that that can cut both ways. So one of the other sort of stories coming out of the data early on and represented in the data early on was this idea of a pyramid, and that youth were much less susceptible to the disease. And it's led to a perception as embodied by these kids in Fort Lauderdale only a month or so ago, that somehow young people should worry less. And so understanding how data tells that story, understanding how data leads and reinforces mental models is a critical thing for us to think about as we try and support and develop solutions in an environment like this. And finally, this idea of reciprocity. I wish that we had some better examples, but this is our government showing and displaying behavior that runs very much counter to what they're saying. The idea that reciprocity is one of the most tangible ways that we understand if we're on the right track, ways that we feel supported and comfortable in making shifts in our own behavior. I'd say face masks in general has been such a messy topic because it is something that very much the visibility of it tells us something, and the data and the story behind it that many governments have tried to tell us run counter to that visibility and that reciprocity. And so that's why I think ultimately it's led to a clear consensus. And I think one of the great examples of how information is only useful to a point and messaging is only useful to a point, but the embodiment of this sort of behavior and the visibility of people en masse has a catalytic effect. So these are some kind of behavioral principles that are emerging. And if we think about the work that I showed in terms of the different ways that designers can engage and some of the principles we can bring to that work, we kind of have a bit of a recipe that we can look at, a recipe for the role that design can play moving forward, and particularly a recipe for UX design. So coming back to that big picture, that macroscope, my firm, Dahlberg, gathered together a conversation amongst leaders in the philanthropic community. Leaders like Dr. Raj Shah from the Rockefeller Foundation, Ford Foundation, the Hong Kong Jockey Club, the largest private foundation in Asia, et cetera, and heard from them about what they feel is needed in order to both get us through this time, but also to look ahead. And the things that they articulated, the needs they articulated, are very easy to connect, I think, with the core capabilities of this community and the kinds of things we can create and produce and build for the world. So we need a higher standard of cooperation amongst and across various governments, communities, organizations, similar to what I showed in terms of some of the knowledge sharing tools that we've had the chance to build around Ebola. So that idea of cooperation. And Rockefeller has invested in something called the Commons Project, which is looking to build digital services for the commons that are developed with civic engagement in mind and with public interest in mind, that put people first, but that are not fundamentally driven and owned by companies and corporations, but are part of a public sector movement that's looking at digital infrastructure in a new way. So this is really a recipe for UX design, and where UX design can be such a critical part of navigating the path forward. That idea has already taken hold in India with the idea of open digital public goods. And Nandan Nilekani, one of the founders of Infosys, led the charge in building what might be the largest piece of public digital infrastructure in the world, which is a system called Aadhaar. It's a digital ID system that is used by 1.3 billion people to access basic services. My team has spent a year studying it and trying to give the government feedback from people around how it's working. Thousands, millions of interactions with it every day in paper form and in digital form. Patterns of behavior emerging very quickly over time. And we've had the chance to observe and provide recommendations on this, and not just from the perspective of the average need and consumer and citizen of India, but we've taken that idea of designing for vulnerability and placed it at the center. So we've done research with migrant workers, and we've done research with transgendered people to try and understand, how does the system work for them? If it can be made and improved, if the user experience can be better for them, again, the hope is it's addressing fundamental needs that everybody has as well. And here's a quote from that research: Aadhaar is like a heart. Sorry, I have to move my little speaker panel to get to the quote. Anyway, you'll see it's become a big idea, and people expect that it is the beating heart of, in many ways, a well-functioning civil society in India and government that provides so many basic benefits and services to hundreds of millions of people. And a sense that it can either support and enable that, or it can become a huge barrier in which so many of the fundamental needs that people have are not going to be met. Similarly, I have worked for about a decade with an organization in South Africa doing the same thing with the health system. So building infrastructure, digital infrastructure, that plugs into the Ministry of Health and the public health system in South Africa to register women and children. So this is a system that's used by 9 million women today. Again, thousands of interactions every day to try and connect women and their children to better information and better care, to track that care over time, and to start to instill basic healthy habits that will increase livelihood, nutrition, survival amongst children. So again, a piece of infrastructure that can be used through WhatsApp, through SMS, through many different services, but that's serving a fundamental public good and bringing the tools and skills and thinking of user experience into an area that desperately needs it. So this is not just about building tools that help us today, it's also about preparedness, which seems like a very aspirational idea right now, but how do we get ahead of not just providing the experience and meeting user needs today, but creating a society that's better prepared in the future. So as I mentioned, we worked with the UN system on HDX when I was back at Frog, and it wasn't just about gathering data and making data available, whether it's on a country level or specific to a crisis like COVID. But it was also about building a community. And we've spent time working with them on trying to figure out how do you increase the digital literacy of decision makers in governments around the world and in NGOs and other big community-based organizations that are trying to respond and support the needs of vulnerable communities, and trying to figure out, well, what does that community look like, and what are the tools and ways you can engage that community on their terms, so that the data that we see as having so much value can actually be meaningfully integrated into the way they make decisions and into the processes and tools that they use today, whether it's things as simple as Excel or other things. So we've been part of not just standing up this platform, but trying to figure out, well, what is the experience that will extend that engagement and keep this community coming back for more information and build their ability over time to use data and use information now that it's available to make better decisions. And finally, it's about unleashing the power and influence of communities. It's not just about these big organizations and these big macro efforts, but getting back to what role communities can play, particularly at a time like this, to meet their own needs and to advocate for the changes and the resources they need. About 10 years ago, I started working with the innovation team at UNICEF, and we helped launch a platform called Rapid Pro and started to look at the kind of digital tools in areas like health that we could deploy that would reach people with information and address bottlenecks and gaps in the way that some basic systems functioned. And out of that came a desire not just to reach people at those particular moments when they're going into a health clinic or getting their food rations, but to create a system where they can communicate with their governments, which is called U-Report and is now in maybe 60, 70 countries, and provides a tool, particularly for young people, to provide feedback to government and to start a dialogue, to talk about the needs in their community and to advocate for the change that they think they need. So U-Report is just another example of something not owned by a government, but that sits across many governments, but government support that allows digital infrastructure to play a unique role and fill a unique gap that requires designers to come in and help think through what are these models for engagement, how does this work, and how can this be as simple as possible. More recently, working with that team, we're helping them scale up an initiative called Giga, which is trying to connect every school in the world to the internet. So creating not just an opportunity at a time like this for students to learn skills in a remote environment through digital hubs and Wi-Fi hubs in and around schools, but also to use that as a jumping off point to connect communities more broadly to critical information and services, to help youth and youth-oriented enterprises and activities tap into information and explore new business models and ways of reaching and sharing information, building new businesses and initiatives in local communities. So this is something that's been scaled up in Colombia, as you can see, to 50,000 schools, Brazil, and now we're looking at half a dozen other countries. And trying to, again, this is not something that's going to be solved in the next 3 months, but looking at a multi-year effort to harness the urgency of this moment towards a much bigger goal, which is long-term opening up a platform for low-cost digital internet access around the world. And around that, the ability to create a thriving ecosystem of open source platforms and tools for communities to use. So this idea of digital public infrastructure and the role that UX can play is gaining a lot of momentum at this moment. It's accelerating at this moment. And for that reason, it's changing the stakes of the decisions we make, of the things that we do and work on. And so I wanted to close by talking a little bit about what those new stakes are for design and what we should be thinking about, and hopefully as a community rallying around in order to make sure that this movement is sustained and that the outputs and the platforms that are emerging to sort of fill this need, to make sure those platforms are well designed and that we bring the highest common denominator, not the lowest common denominator to this work. I started doing this kind of work because there was a sense that in a digital environment, it was a leveling effect, that many people would have access to the same information and the same tools. And certainly for those of you who were working in the early days of the web, a browser, HTML, it was a very simple egalitarian environment. Yet today we see a lot of people investing in experiences that are highly specialized, where good design comes at a price, like Superhuman, where email can be streamlined, it can be beautiful, it can be simple, but you're going to pay extra for the quality of that experience. And I've been thinking a lot about the design systems that we all invest our time in, the corporate design systems that have helped us scale the reach of the work that we do, but seem to represent a world in which everything is simplified and organized into, very pure and streamlined categories of information and interaction. And yet the world is a vibrant, messy place It's a marketplace of ideas and experiences. It's a place where people want to see their identity. They want to see their experience come to life. And so I've been asking myself, who are these design systems serving right now? Do they make us feel good because they're so organized and simple? Or are they really serving the emotions and the needs and the experience that people are having, and creating a place where that experience can thrive and come to life and not be hermetic and so kind of self-contained? And this gets to a core question for us as a community. Do we see the kind of UX experiences, the kind of quality of experiences we're creating as a fundamental right that everyone needs access to, so that they can vote, so that they can take care of their children? Or do we see it as a privilege of a few, for people who have access to the tools and can pay for and understand and engage with the higher end experiences that we we have a tendency to want to create? At this moment in time, I think there's a danger that we're designing new walled gardens where we're creating richer and richer experiences for fewer and fewer people. And that's allowing us to build our skills. It's allowing us to test our ideas. It's a great space for design practice and craft. But at the same time, coming back to the moment we're in, coming back to the fundamental need for a more common layer of social infrastructure and digital infrastructure, it may be pointing our talents in the wrong direction. So I'm going to close, I know there's a bit more time, with a quote from Frank Snowden. And let me see if I can get... I think it's really kind of brings it all home, at least did for me. This comes out of a recent interview on 60 Minutes. So he said, the real source of optimism might come from knowing that the aftermath of plagues has consistently brought about some of the great transformations, leaving societies looking radically different. Order comes from chaos. We introduced sewer systems, toilets, we set housing regulations, paved streets. So the hygiene of modern cities that we see today was built in large part on the sanitary measures that grew out of the terrible experience of Asiatic cholera. So I want to leave you with that thought. This is an opportunity and a time, not just when order comes from chaos, but when great transformations can happen. And we as a community have the ability to drive those transformations, to think about the great digital transformations that will fundamentally change what we think of as a well-functioning, not just city, but society. And that this is the time for us to think broadly and boldly about how we can each engage in bringing those great transformations to life. So thank you very much. I hope this has given you some things to think about as you go into our last bit, I guess, of socializing and back into your lives and into the work that you're going to be doing in the coming months and years. So thank you again, Bruno, for giving me the opportunity to leave you with these closing thoughts. And it's been a real privilege to connect with this community.